Hello and welcome. Thank you for joining us for the 2026 Benefits Overview for the Essential Worker Healthcare Trust, also known as EWHT. I'm Athena Wade, the Member Engagement Specialist for the Trust. Today I'll walk you through the highlights of your health insurance coverage and give you resources to learn more. EWHT is a valuable partnership between SEIU Local 503 and responsible long-term care employers who work together to create this trust. By leveraging state and federal dollars, we're able to provide workers with excellent health insurance at a very low cost. The trust offers either Kaiser Permanente or Regence Optum plans to choose from. If you'd like to follow along, you can scan this benefit guide QR code, or you can find the benefit guide on our website, essentialworkerhealth.org. You'll have two health plan choices under EWHT. Regence is what's called a PPO or Preferred Provider Organization. Regence allows both in-network and out-of-network providers. Out-of-network care is covered, but at a reduced benefit level. OptumRx will handle your prescriptions under the Regence plan. You can find Regence providers at regence.com and look under the Preferred Network. Kaiser Permanente is what's called an EPO or Exclusive Provider Organization. This means only Kaiser Permanente providers and facilities are covered for care. There are exceptions for emergency care or with a referral from a Kaiser provider. You can find Kaiser providers at kp.org and look under the Kaiser Classic Plan. You'll find Kaiser's service area zip codes listed on our website at essentialworkerhealth.org/Kaiser service area. We've got you covered under both plans with free preventative care and free generic drugs. You'll have lower monthly premiums, deductibles, and other out-of-pocket costs. For more details on the plans, visit our website to view both Regence and Kaiser's summary of benefits and coverage. So what's changed in 2026? There have been two enhancements to the plans. Labs and x-rays are no longer subject to the deductible, and Regence members can now fill your maintenance medications at any OptumRx participating retail pharmacy, no longer just CVS or mail order. So let's go through the costs once you're enrolled. Your deductible will be $800 for an individual or $1,600 for a family. Out-of-pocket maximum is $2,000 for an individual or $4,000 for a family. These amounts are very low compared to most insurance plans you can find on the marketplace. That means less money out of your pocket before coverage kicks in and strong protection against high medical bills. Preventative care is always free under both plans. Primary and behavioral health visits are just $20 per visit with Regence. With Kaiser, the first 3 visits are just $5, then $20 each after. Under Kaiser, specialists and physical therapy costs $40 per visit. With Regence, it's also $40 per visit, and physical therapy is limited to 40 visits per year. Urgent care under both plans is $60 per visit. For the emergency room, Regence will charge a $160 copay, waived if you're admitted, then 20% of the costs after you meet the deductible. In a Kaiser emergency room, you'll pay 20% of the costs after you meet the deductible. Lab tests and x-rays, you'll pay 20% per service. There are additional benefits. Kaiser and Regence offer acupuncture, spinal manipulations, and massage therapy services for a $40 copay. Chiropractic and spinal manipulations with Kaiser are limited to 20 visits per year. Acupuncture and massage therapy with Kaiser are limited to 12 visits per year. Regence in-network acupuncture, spinal manipulations, and massage therapy services are limited to 36 combined visits per year. With both plans, most other services like imaging, surgery, and hospital stays, you'll pay 20% of the costs after you meet the deductible. And remember, preventative care is free. If you can keep it 100% about prevention, it will be 100% covered. Pharmacy coverage prescriptions are also very affordable. Generic drugs are free across the board. If you need a preferred brand or tier 2, it costs $30 for a 30-day supply. Non-preferred brands are $80 for a 30-day supply. Specialty drugs are only $100 for a 30-day supply. If you go through the mail order pharmacy, you'll get a deal. You'll pay for a 60-day supply, but you'll receive a 90-day supply. Please note that specialty drugs are not available by mail order. In order to be eligible, you need to work at an essential worker participating employer for 30 or more hours per week and be considered full-time by your employer. You can enroll in 2 ways. You can enroll during open enrollment. This happens once a year through your employer or their benefits portal. You can also enroll during a qualifying life event. These are special life events that allow changes outside of open enrollment, such as starting a new full-time job, moving from part-time to full-time, marriage, divorce, or legal separation, starting or ending a domestic partnership, birth or adoption of a child, death of a dependent, or if you or your dependent lose coverage under another plan. Eligible dependents include your legal spouse, a domestic partner, children under age 26, and children over age 26 with a qualifying disability that prevents them from working. When you add dependents, you must submit legal proof of their relationship to you. Examples are a marriage certificate, birth certificate, or guardianship paperwork. You'll have 90 days after coverage starts to turn in your documents. To verify your dependents, follow the directions on the letter EWHT sends you in the mail. You must send verification documents to EWHT even if you've already submitted them to your employer. Once you receive your instructions in the mail, you'll need to gather your documents. Which documents you need to submit depends on who you're enrolling. For information on what documents you need to submit, visit our website at essentialworkerhealth.org/dependents, or you can scan this QR code. New for 2026, you must submit your dependent's Social Security card, not just their number. An individual tax ID number, or ITIN, can be used if your dependent doesn't have a Social Security number. If you don't have the documents that you need, you can order from your city, county, or state vital records office. For international records, contact the country's consulate or embassy. Many documents can also be ordered online at vitalcheck.com. You could submit documents in one of 3 ways. Upload to the EWHT member portal, essentialworkerhealth.org, send by secure email to essentialworker@risepartnership.com, or you can mail them to the address on this screen. If you do mail them, please include your name and the last 4 digits of your Social Security number. To access the EWHT member portal, go to essentialworkerhealth.org and click on EWHT member portal. You'll need to register as a new user. You'll need your Social Security number to do this. Through the portal, you can upload documents, check benefits, and view plan documents. If you still have dependent verification questions, we're here to help. Call us at 833-389-0027. You can also find more information about dependent verification by scanning this QR code or going to essentialworkerhealth/dependents. So how do I enroll? To enroll or make changes, you'll need to talk to your HR representative, supervisor, or enroll through your employer's benefits portal. Be ready with your name, date of birth, Social Security number, and address, and have the same information for any dependents that you're adding. Once you enroll, you can ask your employer when your coverage starts. Member ID cards and welcome packets will get to you about 2 weeks after coverage begins. And if you don't have your card yet, you can still access in-network care before your ID card arrives. If you add new dependents, you'll get a follow-up letter asking for proof of eligibility. Member support can be found on our website, essentialworkerhealth.org. You'll find answers to frequently asked questions, a summary of benefits, Kaiser coverage area zip codes, and more information on how to verify dependents on your plan. It can be confusing who to call, so here's a quick guide. If you have questions about enrollment status, dependent verification, general benefits info, or have issues with the EWHT portal, contact EWHT. If you have questions about eligibility, how to enroll, your monthly costs, or your employer benefits portal issues, contact your employer. If you have questions about cost of care, finding an in-network care provider, or replacing a member ID card, contact your health plan. For further reference, here's the health plan support contact information. That concludes our 2026 benefits overview for the Essential Worker Healthcare Trust. Remember, you can always find more information, benefits guides, FAQs, forms, and helpful videos at essentialworkerhealth.org. I'm Athena Wade, Member Engagement Specialist with EWHT. Thank you for joining me today, and remember, we're here to help you get the most from your health coverage.